Okay guys, it's Dr. Sexton from San Diego, and today I'm going to talk to you about fatigue, and this particular lecture goes out to my friends who believe that their fatigue is caused by chronic Lyme disease. Now, talking about this has a special place in my heart because I did my emergency medicine residency at Yale University, which is very near Lyme, Connecticut, where Lyme disease was discovered. And having come from California, I had never seen or really knew much about Lyme disease prior to going back east and doing my residency out there. But we were taught that Lyme disease can present looking like almost anything, with a rash, with joint pain, with fever, you name it, it could be almost anything. And if we didn't know what was causing that medical problem, we had to test that patient for Lyme disease. So I get a long thorough indoctrination with how to test and treat for Lyme disease. What you need to know is that this is a parasite that travels inside the deer tick that is indigenous to the East Coast trees and only made its way out to the redwood forest back in about 2015. And so it is a relatively recent acquisition to our wildlife. And when you get symptoms from this, the symptoms can range anywhere, again, from a rash to joint pain to fevers, and treating it with a simple antibiotic like doxycycline would be completely sufficient to get rid of this parasite. And once this parasite has been gotten rid of, the CDC has shown that there are no long-term ramifications to this, essentially no chronic Lyme disease that can come once someone has been treated for this. Now you have to understand that because this is a parasite and not a bacteria that we can find easily in blood, it's not as easily tested for as some of the other things that you may be aware of testing, and that may be where your confusion as to why one doctor may say you have Lyme disease and the other doctor says that you don't. One is taking the science that there is no such thing as chronic Lyme disease and saying that these tests that you're getting that show that you have a titer to Lyme disease is based on a previous exposure to the condition, something that was treated with antibiotics, something that your body fought off. And you're simply being told that this viral titer tells you that you have this condition and should therefore be continued to get treated. So if your symptoms are as ambiguous as most patients with chronic Lyme disease are, then you have these symptoms that, let's say, include a rash, include dry skin, include chronic pain or fatigue. And if you went to someone and they told you, oh, what you need to do is get these IV antibiotics from me a couple of times a week, meanwhile continuing to go to your job, meanwhile continue to do everything else that you need to do, there's a good chance that your fatigue is going to get worse simply because you have to do these additional things to get IV fluids, and you have to heal from those things as well. So imagine how many people going to these naturopathic doctors are going to then say, oh my gosh, I need more treatment, as opposed to saying, oh my gosh, this was all wrong, I didn't have this. And thus it's good for naturopathic doctors' business to describe these things to you. Now, no offense, I'm sorry for saying these kinds of things, but all right, actually a little bit of offense. I get frustrated with practitioners that do these kinds of things and mislead patients and take these scientific studies and misrepresent what they mean to the patients, causing them to get treatment that they don't need. So take a look at this. Look at the research, and again, there is no evidence that there is chronic Lyme disease that sticks around after the parasite has been removed from the body with antibiotics like doxycycline. And thus chronic Lyme disease and fatigue are things that do not exist and should not be treated. And if you'd like to give me a post about this so that we can discuss it, if you have problems with this, I'd be happy to see you and see if maybe we can help you get to the root of what things are actually causing your fatigue, if not chronic Lyme disease.